The Mayo Clinic says young people are at risk of long-term health problems from COVID-19.
One doctor says that he's seen patients who initially had mild symptoms but are now dealing with serious health issues, even after the virus is gone from their bodies.
In this evening's Health Beat, KELOLAND's Tom Hansen looks into why even younger people are coming down with what's being called post-COVID syndrome.
With some of the variants that we've seen, it's been impacting younger adults.
As South Dakota state epidemiologist tracks a rise in variants, next door in Minnesota, specialists at the Mayo Clinic are watching something else that is impacting younger people: post-COVID syndrome. Research is showing that even people who have mild symptoms to COVID-19 can still suffer serious complications after the virus has left their body.
The body is in a hyperimmune and in hyperinflammatory state after the COVID-19 infection, and it gets sort of stuck there. And it's almost like the body is trying to fight an infection that's no longer there.
The body, in essence, attacks itself. Dr. Greg Vanishtashoran heads Mayo Clinic's new COVID activity rehabilitation program. He says COVID-19 can cause severe fatigue and increased risk of damage to the heart, the lungs, and the brain. And many of those symptoms are showing up after mild cases.
While it may seem like the younger population is impervious and a mild illness is all you can get, we expect that this is going to happen in 10 to 30% of the population that gets COVID-19, including our younger patients.
Dr. Vanishtashoran says when it comes to post-COVID syndrome, there are a lot of questions that need to be answered.
Are patients going to have more likelihood of getting Alzheimer's disease, or will they have heart problems going forward? The scary answer right now is that we just don't know.
Dr. Vanishtashoran believes the best way for young and old to protect themselves from post-COVID syndrome is through vaccination. With HealthBeat, Tom Hansen, KELOLAND News.
Congress has approved more than $1 billion to study the long-term health consequences of the COVID-19 virus.